guys, I'm Maylindo Van, certified athletic therapist and founder of Rehab-U Movement and Performance Therapy. I'm here with my good friend Alexis, who's going to be my supermodel for this capsule. Alexis is a kinesiologist. He's the owner of this box that we're in today. So we're going to talk about lateral hip pain. That's a very general term, but it used to be that lateral hip pain was often diagnosed as trochanteric bursitis. More recently, they're realizing that in most cases, lateral hip pain is due to gluteus medius tendinopathy. Regardless of that, both the bursa and the glute med tendon are going to be influenced by the same pathomechanics. The kind of things that are going to be irritable are going to be the same, or very likely be the same. So your management strategies would be similar, whether the bursa or the tendon are affected. And those pathomechanics, what we're talking about is adduction under load. So that valgus stress that we talk about a lot, those knees caving in, so that adduction on functional movements is stuff that will typically irritate the lateral hip. Okay, so what is often done in cases of, or what is often prescribed in cases of glute med tendinopathy or trochanteric bursitis, basically lateral hip pain, is that people are given stretches for the glutes, for the IT band, to kind of get in there. And it's kind of something that I talk about in my capsule, Stop Stretching for Tendinopathy. The go-to treatment, or part of the go-to treatment for tendinopathy, is people are often prescribed stretches, but a lot of those stretches place the tendon under compressive load. And that kind of goes against the current research that tends to show that compressive load on the tendon is really irritable. So if we have the glute med tendon that's irritable, we don't want to increase compression load because that's just going to be more irritable. So a lot of the classic stretches that people are being prescribed actually increase compressive load on the tendon, or place the tendon under compressive load, and as such will also compress the bursa. Hey guys, thanks for watching our videos, and don't forget to subscribe to our YouTube channel. Often people are prescribed like a piriformis stretch, which places the hip in a flexion, adduction, right? External rotation position. So he's going to be like this, pulling the knee to the chest, okay? And that creates a compressive load on the tendon. Or the other stretch that people will be given is a thread the needle, okay? Thread the needle for the glutes, which is going to place the hip in flexion, abduction, and external rotation. And that also creates compressive load on the tendon. Then the IT band, the classic IT band stretch, is to cross the leg behind, placing the hip into adduction, and then jutting the hip out to get that IT band stretch. So again, that tends to increase, or that will increase, compression load on the tendon. So all of these stretches that we're typically giving people are actually likely to be more irritable if someone is already really irritable. Someone has really reactive lateral hip pain. So granted that the IT band tensioners can be like facilitated and overactive, these are not the types of stretches that we should be giving people. Instead, we should be finding other ways to release that tension. So if we're talking about the IT band, the vastus lateralis inserts on the IT band. So those are the kind of things that we could release using other soft tissue. Now's the time to roll on your foam roller to kind of alleviate that muscle tension. Okay, but the stretches that place any kind of adduction stress on the hip are going to be irritable. Now, in the second part of this capsule, we're going to talk about exercises that you can use to kind of reactivate the famous glute med that we're always trying to reactivate, which is of utmost importance in that frontal plane stability of the pelvis to prevent that excessive adduction under load. So those pathomechanics that we're trying to correct that contribute to the lateral hip pain. So we'll see that in part 2.